For a first ever national survey on the mental health of youths here, the study aims to identify specific issues, challenges and common psychological problems.
Well, for more, we are joined by the two principal investigators of the study, Dr. Mythily Subramaniam, Assistant Chairman, Medical Board Research at IMH, and Dr. Swapna Verma, Chairman of the Medical Board at IMH. Welcome to you both. First, Dr. Swapna, please remind us and give us the context in which this investigation is taking place or will be taking place. How often are the younger people seeking help and what issues are they presenting with?
Yeah, so there is growing awareness of youth mental illness, youth mental health in the young people. We have a service called Chat that serves the young people. And last year we saw more than 2,100 young people come forward and seek help. At IMH, even in our emergency services, in our clinics, we have seen a rise in young people coming forward to seek help. The most common symptoms that they come up with or they present with are anxiety, depression, adjustment disorders with stress.
Dr. Swapna, what you mentioned, so anxiety, depression, these are what one would expect quite naturally of someone, say, in their late teens to early 20s. You are going through tertiary education. There's necessarily stress. There is competition because that's what grades are all about. Then you fight for jobs. You are aware of how you look. You want to compete with your colleagues, with your counterparts. You can say these are trends that lead to symptoms like these. And these are, in a way, what we can expect. But would you be able to identify trends that are, from your point of view, not normal and therefore need to be addressed?
Yeah, so exactly as you said, these are normal. Like youth go through many transitions from school to tertiary education, from tertiary education to jobs, and one expects, some symptoms of anxiety, stress to emerge. But this is also an age which sees emergence of adult mental health conditions. The Singapore Mental Health Study showed that the median age of onset of mental illness is 21. So one has to be able to sieve out what is emergence of mental illness from normal day-to-day stress. And that is important because mental illness can have an effect on their functioning, on their distress, and can affect their trajectory of life. So it is important to really kind of pick up emergence of true mental illness from regular day-to-day stress.
Well, this is the first time that we're also going to have a comprehensive national study on youth mental health, but also thrown into the mix are factors that you're testing, including satisfaction with living environment and also trust issues with the government, safety issues, inclusivity issues. How do these pieces of the jigsaw puzzle fit into the bigger picture of mental health?
If I may take that one, I think we know, for a very long time, we have felt that mental health conditions are all about the person. Unfortunately, people go on even to believe that mental health conditions are caused due to some kind of weakness in a young person. And here, what we are trying to do is we are trying to look at some of the social determinants of mental health and all the things that you talked about, which is things like adverse childhood events, neighborhood safety, trust in government. All of them are inclusivity, social inclusion. These are very important social determinants of mental health that we know are important, especially in youth. And that is why here there is an attempt to also look beyond just the person to factors which are, completely outside, external to the person. And looking at these social determinants, we hope that we can then have certain factors that at the policy level, we could change, which could then hopefully, fingers crossed, prevent at least the emergence of mental health conditions in some of the young people.
Dr. Mythily, I'll pick up on the methodology of your study. It will involve, earlier we heard, 2,600 young people aged between 15 and 35. And your colleague, prior to, we just asked her this question, she said it's important to identify the emergence of mental health issues separate from sort of background anxiety which any young person faces. Now, what kind of questions are you going to be asking that will separate out the wheat from the chaff, as it were? So, because if you ask, are you anxious? We are all going to be saying, I'm anxious, but that does not necessarily make me a sufferer of mental illness.
We usually avoid questions like, are you depressed and are you anxious, as a direct question. This is for two reasons. As you rightly pointed out, for some of us, we would be very forthcoming and we would say we are anxious. But we also feel that for some people, they are not very comfortable to just say that they are anxious. So the questions are asked, using validated questionnaires. And so these are a series of questions which ask them with well-established cutoffs, which give us an idea that if they meet this cutoff, so one off, if the person says that, I have been feeling somewhat stressed, they wouldn't just meet the criteria. So we are going to assess that. But also, as Swapna said, we are also looking at the functioning of these young people. We are trying to see whether the functioning of these people is affected. And that's a very important factor to look into it. And what we are also trying to see is other things like, social support, whether this person has adequate social support, what are the coping mechanisms that this person is using. And then, as you said, the general well-being or a quality of life kind of a questionnaire. And putting all this information together will give us a better idea about the state of mental health of the youth population in Singapore.
Well, it's a big project, Dr. Swapna, so you must have also some very big goals as well that you want to get out of this. So what are some of the immediate actions that you can get once the results come through? And what are, down the road, what are some of the early intervention measures that can be taken on a national level? Dr. Swapna?
The findings from this research study would be very important. Firstly, it would tell us the prevalence of the disorders in Singapore. Not only that, it will tell us how do the young people seek help? Where do they seek help from? So this will help in service planning. How do we plan better services for them? The other thing is, as Mythily said, we will be looking at certain risk and protective factors. So lifestyle, impact of, say, drinking, smoking, exercise, or even social media use, cyberbullying on their mental health, or protective factors such as resilience, social support, self-esteem. So by having an idea of what are some of these risk factors and protective factors, then we can use that upstream for our preventive efforts. During preventive efforts, we would want to minimize the risk factors and maximize the protective factors. So this can help both at an individual level as well as at population level.
All right, many thanks to you both. We've been speaking with Dr. Mythily Subramaniam and Dr. Swapna Verma from IMH.